The reality of things is it's expected to get worse before it gets better for New Yorkers amid the COVID-19 outbreak. We're already seeing the number of cases jump along with the number of deaths. That's the unfortunate reality. So joining us this morning is City Council Speaker Corey Johnson. Good morning to you, Speaker, and thanks for joining us.
Good morning, Dan. Thanks for having me.
So the big story, Speaker, is obviously the conditions over at Elmhurst Hospital this morning. The reports there from the nurses on the inside describing it as apocalyptic. What are you hearing about the conditions on the inside, and what do you think is anticipated there in terms of getting the supplies to public hospitals across the city?
Well, there is a general issue, as we've been hearing about for days, from the governor and from the mayor as it relates to personal protective equipment, the N95 masks, the surgical masks, the gowns, the gloves, the visors. That's all the PPE, coupled with the need for a massive increase in ventilators. On Elmhurst, clearly there must have been, or there has been, widespread community transmission in that part of Queens, which is overwhelming Elmhurst Hospital. Clearly it's the most overwhelmed hospital in New York City right now. You saw the video from the New York Times yesterday from the ER doctor. And I think it's really important, Dan, that we level with New Yorkers and let them know that that could be other hospitals soon. We don't say that to scare them. We say that to let them know that they need to stay home. The way to help our healthcare workers, the way to help our hospitals is to actually halt transmission even further so that you have less of a strain on the system. And so we're getting more personal protective equipment that's coming into New York City, but we need to ease up on the strain, and the only way to do that is to halt transmission and to stay home.
So let me ask you specifically about Queens. We're understanding that at one point we're hearing reports that they may have run out of oxygen. Obviously, we're knowing that supplies are low in specific things. What happens if they do run out of supplies? What's your advice to the workers on the front lines there in Queens? Do you move patients to other areas right there? There's huge lines wrapped around the block this morning.
I believe the lines that are there are actually for testing, which is why you see a tent set up outside of the hospital for people that may be mildly symptomatic. You see those tents from the aerial shot right in front of us. That is for testing folks. Yeah. I'm told, we never should have been in this situation in the lack of personal protective equipment. And it's why the federal government should be coordinating a response for the hardest hit areas in the country. And New York City is now the epicenter in the United States of America for coronavirus.
So speaking of the federal government, Speaker,
the healthcare workers, the nurses and doctors and frontline workers that are really heroic and that are away from their families, saving countless people. I also want to thank the grocery store workers, the pharmacists, the transit workers, the cops and firefighters, the folks working at these enrichment centers. They are all our heroes on a daily basis now.
Speaking of the federal government, we're hearing the new unemployment numbers this morning. They were higher than expected, historic highs right now, which we expected. We're also hearing about the stimulus package, $1,200 checks that could go to families of a certain income level. Your proposal is actually expanding on that. You want to give people more. What is your plan and what is your message right now for the federal government?
So I put forward a plan last week, even before we knew what this stimulus package was going to look like, which was calling for an additional $12 billion to New York City. And that would allow us to do universal basic income, a check cut to New Yorkers on top of what the federal stimulus money is. It would be about $600 more per week in unemployment. Because we know the cost of living is much higher here. I've also called for us doing a rent freeze and a mortgage freeze. April 1st is 6 days away. A lot of New Yorkers are very anxious. They haven't gotten the infusion of money that Washington's been talking about, and we need to get direct relief into people's pockets right away who have seen economic ruin overnight. Domestic workers, freelancers, gig economy workers, small businesses, hospitality industry folks. We need to deliver money to them.
I have to squeeze in one more question here. We're almost out of time, and it's really a twofold question. How long do you think the city will actually be shut down? And you have been in close connection with the governor. You had to come up with this plan to close some streets down. It seems like a very small area in each borough that's closed down that people have to actually travel to. Do you see this expanding so more people can practice social distancing?
I want it to be a bigger area, more streets, but one of the issues that we've run into is the lack of personnel that we have to make sure that those areas remain safe, that you're not seeing crowding there,
Yeah.
and that you are protecting folks when you're closing streets. So that's one of the big issues. But I wanted wider swaths, longer avenues to actually accommodate folks that may be crowding in to parks. On the length of this, I don't know, but I think that New Yorkers should expect for this to go on for a long time. The mayor of Los Angeles yesterday, Eric Garcetti, said he expects it to happen in Los Angeles at least into May, maybe longer. And Los Angeles is not nearly as hard hit as we are in New York City.
Yep.
So this is going to change life as we know it here. But lastly, Dan, I want to give hope. We got through 9/11. We got through Hurricane Sandy. We got through the Great Recession.
That's right.
New Yorkers are a special group of people. We need hope during this painful time. We're one New York. We need each one of us to come together, socially distance, and help us get through this crisis.
Appreciate your message.
Thanks, Dan, for all your coverage.
Yeah, of course, and appreciate you, and you're joining us this morning. Stay safe to you and to the entire city council. I appreciate your time this morning.
Thanks.